Hi, it's good to be with you. Vaccination, from an orthodox point of view, is the first line of defense in preventive medicine. If you're a parent wondering if you should expose your children to it, or you could be an elderly, sensitive, or a pregnant woman worrying about the effects of vaccination, this video will help you. All of the information that we will go over is from the book Eat Right for Your Type by Dr. Peter J. D'Adamo. Hit the like button, subscribe. It'll motivate me to do more good videos like this. Share your experience on vaccine in the comments below. Let's start with influenza A. When a new antigenic variety of influenza virus appears, blood types B and AB are more susceptible to infection. When a virulent strain of influenza virus is in circulation, blood type O is more susceptible and they get hit the hardest. If you are type A, consider yourself lucky when it comes to influenza A because you have a generalized susceptibility to the less virulent strain and therefore you're less likely to contract the more severe variety. Let's go over all of the vaccine sensitivities for type O. With all vaccines, parents of type O children should be cautious to any sign of inflammation such as fever or joint pain because type O immune system is more prone to these reactions. In general, parents should try to space out immunizations because this will give the immune system sufficient time to adjust to the stimulation. If your children with blood type O have been recently vaccinated, you should watch them carefully for a couple of days to make sure there are no complications. Don't give them acetaminophen. It is an over-the-counter medication that is commonly prescribed for vaccine-related problems. It is also found in Tylenol. Based on experience, type O children seem to react poorly to this drug. However, there's a good news. There's a natural remedy that will work for type O, and it is an herb called feverfew. It is derived from common chrysanthemum flower. The botanical name is Chrysanthemum parthenium. You can use the liquid tincture form and you can give it to your child every few hours. 4 to 8 drops of the feverfew tincture in a glass of juice is sufficient to achieve a positive result. If you are a pregnant woman with type O blood, the flu vaccine holds special dangers, especially if the father of your baby is a type A or type AB. The flu vaccine can boost the presence of anti-A antibodies in your system, which could attack and damage your fetus. Blood type O has a relatively effective ability to generate the natural antibody response against influenza A, H1N1, and A, H3N2 viruses. Your antibody response against influenza B is not as dramatic as seen in other blood types if you are type O. If you are a healthy adult, you don't need a flu shot. There is some evidence that type O does not seroconvert well after a single dose of the flu vaccine and may in fact need 2 doses to build up proper immunity. Let's go over all of the type A and type AB vaccine sensitivities. Type A and type AB children typically respond well to vaccines. A full vaccination program that includes whooping cough vaccine should produce few side effects. Although it is recommended against aggressive scheduling vaccines after vaccines back to back. Type A tends to respond well to the typical flu vaccine, usually seroconverting after 1 dose. Overall, influenza is probably most problematic year to year for type ABs. In general, they are more sensitive to infection by both influenza A and B. They're also affected by these viruses earlier and more severely and need to be extra cautious regarding an abrupt change in the influenza A virus as well. Here we go. Type B vaccine sensitivities. It has been observed that type B children sometimes have severe neurological reactions to vaccinations. Parents should watch their children for any signs of complications. It could be the way your child walks, crawls, or some kind of personality change. If you decide to vaccinate your child who is type B, it is important to make sure that he or she is completely healthy first, free of colds, flu, or ear infection. And type B children should be given oral form of polio vaccine. If the question on your mind is, why does type B tend to react so badly to vaccines? It may be because of a particular vaccine itself that causes this cross reaction with either the type B antigen or with opposing blood type antibodies. Or perhaps it's one of the chemicals used to enhance the vaccine's effectiveness that causes a bad reaction in type B individuals. It may even be the culture medium used to grow the vaccine. We just don't know yet. Type B has a reasonable but not great ability to generate an antibody response against influenza A H1N1, but has the slowest. It can take 3 to 5 months, and weakest ability to generate antibodies against influenza A H3N2 of any blood type. However, type B has a significant advantage against influenza B virus because it responds differently. The type B immune response happens much earlier and persists longer. Blood type B is going to be the most severely affected when influenza A H3N2, also known as Hong Kong variety, and its relatives are in circulation. Type B individuals have relatively little difficulty with influenza B, but have to be very concerned about an abrupt change in the influenza A strains. Thank you for watching. Heal your body and mind. Stay fabulous and see you in my next video.